Financial burdens of growing a child with hip dysplasia. Every milestone ahead for a child with hip dysplasia is just a testimony to their strength and ability, as well as their family's adaptability, even to face the financial challenges. Hip dysplasia occurs when the femoral head is not properly positioned in the socket. Due to this misplacement, the hip can become unequal or less rounded, which in some cases causes pain. Most doctors define hip dysplasia through imaging findings to find the abnormalities or the sizes. The cost of caring for a child with hip dysplasia is high and it continues to rise. These financial burdens is divided into three main categories. First, there are the direct medical expenses, then we have the physical therapy, and lastly, we have the specialized equipment. To begin with, hip dysplasia can result in a very high cost, which can add up very quickly, and all of these costs come out of your pocket. Medical costs, whereby you have to look out on your own to find your child's um, ultrasound or x-rays, the pains of the ultrasound and x-ray, that's what you have to do for your child, and all of those things come out of your own pocket. They also the doctors also suggest a surgical reduction, but if that fails, the child may need open or closed surgery. They will request one for the child to correct the hip dysplasia. But we have non-profit organizations that are willing to help families with these type of cases. For example, we have World Pediatric. They deal with kids with these special needs. Additionally, physical therapy plays a big part when treating hip dysplasia, and the type of therapy you need depends on the child age or how serious the child's condition is. So in that case, treatment usually focuses on keeping your hip in the right position and building the muscles around it. The physical therapist engage the kids on daily activities, special activities that are required for them to improve their flexibility, strength, and balance. Physical therapy normally becomes important after a surgery to get back to your normal movements or daily life movements that you had previously. They introduce the child to do daily activities like getting on their own, getting out of their bed by themselves, to keep and so that they can have a healthy and active childhood. Getting help early and sticking with therapy makes all a difference. Physical therapy helps kids avoid lasting pain and gives them the best shot at a normal, active life as adults. Furthermore, the cost of specialized equipment, it stems from the investments in casting and pelvic harness, which is essential to maintain the child's everyday mobility and safety. The need for special equipment arises from the limits and challenges that hip dysplasia can impose. Normally, the bracing they introduce a soft bracing. The bracing normally needs to be changed depends on how the child outgrows the bracing. It needs to be changed every 6 or 12 months. Depends on how the child is doing, then that's where they would allow you to change the bracing. Therefore, this equipment is a long-term and ongoing investment in the child's life. However, without this equipment, the child's level of independent daily function would be more difficult. In conclusion, the financial journey for a family Navigating a child's hip dysplasia is a daunting one defined by significant and often overlapping costs. This profound financial burden is composed of the price of direct medical costs, physical therapy, and the specialized equipment the child needs in his or her life to, to get along a stable and active and a healthy life, to be a normal person in their life. It has been demonstrated that the initial expense of just the start, the long term commitment of rehabilitative therapy is essential for regaining strength and mobility. Ultimately, the question for these families is not about the cost, but the value of a brighter future, a healthier one, a commitment measured in more than just dollars in their child's life. Thank you.